American Express gift card. 150. Oh my God! I love it. All right. Hey, you want your latte back?
And it works because I copied her and it's all my
I was going to say, and it works because I copied her, and every first referral for an account, I went into the office and took all the little latte steaks latte. They loved them. Yeah, and so some of those have get sent a second, you know?
Yeah, way to go. Thank you all for participating. That's really important so everybody could get a look at what you're doing in all the different markets. So I believe that I may have mentioned to you that I had a surprise at the end of the conference.
Wait. Hold on, Sherry's trying to talk.
And the surprise today is having Jamie Vicente with us. Jamie is a regional sales director with St. Jude Medical. He's worked with them for the last 3 years. He's a cardiovascular open heart PA. And we are forming a partnership with Jamie and St. Jude Medical across every one of our markets. That includes both states. And Jamie's going to introduce to us today some leading edge technology that has been approved by Medicare, and that is going to change the way that patients with congestive heart failure are treated and managed and monitored. Come on in, Jamie. Thank you so much for taking time on Saturday afternoon to be here. I appreciate it.
Thank you so much, Sharon and Zeus, and the gracious welcome. If you would have told me 5 years ago that people would be excited about heart failure, you would have been thrown out of the room. Why is heart failure important today? We're going to go over that. And for those of us who are not blessed to be 6'4" and handsome and walk everywhere and get everything, the rest of us have to look for an edge. Have to look for something different, have to be creative. The more competitive our landscape is, how do we differentiate ourselves? So today, you guys are so lucky, and I say this, I'm telling you, you don't know what we have here for you today. So you ever say to yourself, do I have the right product, the right time, with the right people, right distribution, all those things lining up for you? We have that for you here today. This is a gift. This is a gift for all of us, okay? It's a gift for patient care. I wrote some things down about some of the things I learned. I've only been here a couple hours, but I wanted to come and get a little bit more understanding of your body of work and the things that and your struggles every day. I have to credit one of your A's, who's their superstar, in the room, because I've been working in the field. I've been in sales for 15 years, marketing, networking, and building relationships. I've come across a plethora of home health care reps throughout my entire career. So I walk in the office, I see them there, they're pretty, some of this, they hand pamphlets, they go home, they go to when we have dinner, they smile, they go home. Not one ever has ever told me something unique about what they do. What makes them different? So for the first time I heard Ms. Janita talk about heart failure readmission reduction program. And I'm like, what? Let me see that paper. You're the best. You're lower. I go, you have no idea what you just said. You know what I've been working on? A little bit about my company. 16,000 employees, $5 billion worth of sales. And we are targeting this as the main initiative to treat heart failure readmissions. So we've been focused on hospitals, we've been doing all these things, looking for certain select patients. Who are we looking for? What criteria are we looking for? Well, I need Medicare patients. Somebody in the room is always telling me, well, that doesn't count, I need Medicare, Medicare, Medicare. I said, well, I'm looking for that too. And then she says, well, I want to help reduce heart failure admissions. I said, well, that's what I'm doing, right? So now, obviously, you can see that there's some synergy, there's some collaborative effort that we can go here. So I get the opportunity to come up with a new product. I'll go over the product, why it's important today in today's market, the solution that we have for it, and the windfall that you guys are about to step into. Where does do you have a laser pointer?
Oh, I've got your clicker.
So now you're quiet, you're listening. Medicare patients, heart failure, teaming up with a Fortune 500 company. Okay?
That's a big deal.
This is a big deal, guys. This is my personal project from corporate. This is an initiative that I put in front of the VP of the company that I'm running with. This is at the beginning. It's never been done before. We've never partnered with any home health care agency. I'll tell you why we picked home health. We're a little biased in the area. So I'm going to start with saying something so small can have such a huge impact. So I'm going to pass this around so you can look at the actual device that's going to go in the patient and how we're going to use this to better manage heart failure patients. Okay, so when we enter a hospital and we talk about heart failure, we've got to break it down in numbers. What's the impact? Why is it important today? Why did it not matter 5 years ago, 10 years ago? The disease state was still there. We've done a very good job at managing the acute phase of cardiovascular disease with acute MI, stents, and all that. We'll get you to a heart attack. Now we have chronic disease management, okay? $31 billion is spent on heart failure. By 2030, you're looking at $70 billion. Half of these costs are spent on hospitalization. We look and we care about things that we never cared about before. We can no longer be transactional salespeople. We're consultants now. We have to work at a higher level. How many here have an MBA from Harvard? None, right? How many here graduated from the Zig Ziglar School of Sales? Did you? We got one. That's great. How many people know who Zig Ziglar is? All right. My point is, we don't need experts, okay? By the time I'm done here today, I don't need to be a certified expert. I'm going to sound like an expert. And by the time I'm done with everyone here today, you guys are going to sound like experts. So, some facts and things that came to my head and was brought to my attention, it only takes about 5 books in any given topic to make you what we call an expert. By the time I'm done with you today, everybody's here going to talk lingo that your counterparts in other home health care agencies won't have a clue. Okay, economic risk. So when we present to hospitals, these are the top, this is how we hit the hospitals on being able to provide our technology and service to help with these heart failure readmissions and the penalties that they're suffering. So it's good that you know these. You guys already know about pneumonia. I heard you talking about it. CHF, why it's so big? Because they're getting penalized for heart failure readmissions. Okay? $280 million was withheld. Can I put this on here? Does this work?
It does.
Okay, so in 2013, we had $280 million withheld in penalties, with 2,200 hospitals being impacted. So what we do, we extrapolate that data and we create a scorecard. We create a scorecard specific to each hospital. So then we know what hospitals to target, which ones are in need, and which ones we can provide a solution for, right? So, Medicare Readmission Reduction Program, 2014, $214 million hit penalized nationally. 2015 projections, $400 million. And 38% of them failed to improve from the prior year. So these are penalties as time went on that the hospitals are getting tagged with, right? So now we have a problem. This is a specific scorecard to a specific hospital, which I targeted for this particular technology. So if I tell you that I have a solution for this to reduce these things and to increase your margins, would that be of interest to you? Obviously, if they love it. And my target market is CHF. I'm beginning a launch. I have the technology, it's fantastic. I have people in the field that are already kind of committed. They don't have the time to dedicate to this thing. I could wait and do what the rest of the organization is doing and wait for organic-based growth. Wait for the hiring process. Wait to develop a team. Or I could be invited by Sharon and Zeus to talk to an entire organization who's focused on the same thing and partner with them. That's the route I'm going. So we talk about the hospital readmission penalties, what belongs to the state, what their costs Medicare spend per dollar. This will soon be tracked to the physician. So I say, doctor, if I can help you reduce the overall Medicare expenditure costs when you go to present to your governing insurances that's of interest, it's going to be a scorecard. So physicians are going to be scored and measured on their results per diagnosis. So if I say, if I help you as a physician, as a home health care rep, to reduce those numbers, make you more cost effective in providing care, that's going to be important to you. So, remember I told you, it doesn't need to be an expert. Very simple. What's heart failure? Weakening of the heart. I don't have enough oxygen. No nutrients. They talk about right heart failure, left heart failure. No big deal. Systolic, diastolic. Ejection fraction. It's just the pumping efficiency of the heart. Good numbers, 55, 60. If you're below 35, you're at risk for sudden cardiac death. You don't have to be that great. But then they subdivide it. Some people say, oh, class 3 heart failure, class 4, oh, I'm so confused. Very simple. No one's ever going to tell you 1 and 2. They'll never say it. 1 means you have heart failure, no restrictions, you don't feel it. Number 2, you have some slight restrictions in what you do. And the class 3, which is where most of the work is comfortable at rest with shortness of breath on exertion. And number 4 is no physical activity and without system. You have symptoms. Okay, so not that complicated. Most of your body of work is going to be here. Okay, this is an important slide. If you talk like this, I'm telling you, they can't come close to you. Weight changes, here. Standard of care. That's what's happening today in today's market. Weight changes, by the time you see weight changes, weight is almost too late. It's the best we have. And you guys are doing head and shoulders above your peers, and it shows in your data. And that box is amazing. Whoever thought of that, he needs an award or star. So what we look in here, these are the days prior to admission. So if I look at, I don't know if you have a light here. Okay, so if I look at weight changes, decompensation, 10 days, 5 days, usually about 3 days. You have 3 days to respond to this patient before that patient gets hospitalized. So your time to intervention is very, very low. The technology we have, oh man. Okay, so the technology we have here that goes in pacemakers and defibrillators is here. It measures impedance changes in the thoracic cavity that suggest fluid overloads. Same thing. However, it's 10, 15 days out. Technology I'm talking about today will give you 25 days notice that your patient's getting in trouble. Wouldn't you like to know that information, to get that information to your doctor? So get your doctor in tune. Say, Doc, I'm going to get your patient before he gets symptomatic. That's unbelievable. Okay, so what is it? It's that little device going around. If you can identify congestion early, it will lead to early treatment for prevention, hospitalization, and the slow progression of HF. Okay? 90% of hospitalization present with symptoms of pulmonary congestion. Okay, these are just by the numbers. Okay, so this is the technology that we're talking about. Where it stands now, we talked about earlier, recent FDA approval, CMS Medicare reimbursement, indications, class 3 heart failure with 1 admission in the last year. Very broad-based indication. Here's what it is. It's a sensor. I'll show you a little video of how it gets implanted. 25-minute procedure. Electronic system. This is where you guys come in. You guys are going to be the only ones educated and trained on this technology here. So when I go to my doctor, when I launch these sites, we did 6 last week, I have 17 this week. By the way, all Medicare, all heart failure. I say, Doc, I'm working with a healthcare agency that's educated in this technology and is going to make sure we have patient compliant. Without patient compliant, none of it works. If you guys are doing height and weight and following that patient, all you have to do, by the way, you know what it takes to do this? They lay on a pillow, they press a button. But you guys are experts. I'll train you to do that because nobody else knows about it. What did I tell you? It's going to sound like an expert. You guys are experts now. Data retrieval. This is the information that gets sent to your doctor, sent via text, email, log, patient data. So they're going to manage to pressure, not to symptoms. Different world.
Can you say that again?
They're going to manage to pressures, not to symptoms. So, in terms of the progression planning, by the time the patient is symptomatic, he's already on his way to decompensation. If I can see a change in what we call pulmonary artery pressure, then I can intervene earlier with proper diuretics and things that are necessary. Okay? So what did it do? It's proven, 37% reduction in hospitalization in 15 months. We extrapolated that data because the 15 months wasn't as important to the hospital as the 30-day readmission rates. That's what they wanted. So, okay. We reduced 30-day readmissions by 78%. So what if I piggyback? Chose you because you had great results, good team dynamics, good energy, young, and I improve your numbers that dramatically. Because you guys are all over it. So now when you go to the table, and look, I'm 95% ahead of my peers. No one can come close to us in heart failure management. This is the reduction in all-cause, 30-day all-cause, 78% for heart failure. Complication rates, zero sensor rates, 98.6% complication-free. When you're doing a study, anything that happens during that procedure is attributed to the device itself. There's only 2 complications adjudicated to the particular procedure, and one of them because somebody did inflated a balloon in the pulmonary artery, caused a little dissection, uneventful, no complication or sequela to that particular patient. There was another procedure who deployed a device and had to retrieve it. They categorized that as a complication. No patient was hurt, nothing like that. Okay, so I needed to know a little bit about, I was honored when you asked me to come. I'm like, okay, let's go, we're in. We're in. So I said, now I got to do work. So I wanted to understand what it is. So you have 12 million individuals currently receive care from more than 33,000 providers. Okay, this is from 2009, and it's $72.2 billion spent in the home health care agency. So if I'm launching something, and I could educate 33,000 people to have the same conversation, the power of numbers is ridiculous. So we talk about, is there a pen over here?
Yes, sir.
So I'm a specialist in, so is Zeus, in networking. Don't get confused with not working. There's a big difference. I got to treat, to the untrained eye, it may appear that we're not working. That's what, the new guys never get that piece. Like, oh yeah, you're just having fun. Thank you, I'm sorry. So, you guys put a tremendous amount of energy in what you do. But I didn't see too much focus on working through others and networking. I think it was hit up there, and the power of 2. And I think someone did say it earlier, if you don't know, so if you can't help me, do you know someone who can? That's so powerful. Just the power of 2. I'm one guy, but I know 2 guys. Okay? My 2 guys, no 2 guys. Most powerful thing you can learn ever. No meaningful success happens alone. The people who tell you I'm awesome, I can do it by myself, foolish. They'll only get so high. Unless you can help others and reproduce the effects. It doesn't matter if I have the world-renowned expert sitting right here. Okay, you're amazing. I want everybody to do the exact same thing that I'm doing so we can reproduce in masses. And that's what's going to give you not only 150, 1,000% growth. That's what I'm thinking that may be of interest to you guys. All right. So, recent launch, I went in November with my first talk. It is, mid-January. I have 5 accounts up and running. Indian River Medical Center, I don't know who has Vero Beach. It's north, Okay. Longwood Regional Medical Center, that's Fort Pierce, the Treasure Coast area. We just launched there 10 days ago. I did 14 cases. Bethesda East. Bethesda East, launching this week with 9 patients. University of Miami, just launched. They did 3 or 4, and South Miami just got their product, and they're coming up online. After that, this thing's going exponential. So, home health care, what's a synergy? What's a synergy between us? So CHF is a top priority for many home health care agencies. You guys are tracking, you're reporting your admission rates, you have contact points that I want. I have all the specialists in the world. My customers, where do they get their value from? How do I talk about, don't be that. Can I get a case? I love those competitors. Eat them up all day long. What can I do for you? How can I bring value to you? How do you want to grow your business? Who are your contact points? Your subspecialists? Where are you getting from? Who's your referral base? You had 3 heart failure admission. Who's the primary? I need to meet that primary. Primary meets the cardiologist. Cardiologist meets the implanter. Get in the way. You got to get in the way of the continuum of care. We always talked about in training, follow the drop of blood through the heart. Eat that drop of blood and describe it. Some of you may have done that. Why don't I get myself in the way of that patient care, the continuum of care, bring it 360? I can't do it. You just keep bringing it all the way around. There's probably 4 or 5 people involved in that patient. You could say a primary, gets to a hospitalist, gets to the cardiologist, and gets to the interventional cardiologist or the implanter. You guys, what used to be the least influential, now is the most powerful. It went full circle. The specialist used to have all the juice. My company was built on always follow the juice, the gatekeeper, who has leverage, who controls the business. Then we say, hey, we got to pay attention to the cardiologist, then the hospitalist, and guess what? This guy controls everything now. Because if he don't move, nobody moves. What are his insurance demographics? What's his breakdown between Medicare and managed care? So get yourself right here. You'll own him, and him, and my company, if you play wisely. Because I got resources, I got the budget, I'm educated, we got everything. So we line these all up. There is no other company, health healthcare agency, that's even thinking remotely of that. So what are my challenges? Brand new launch, hurry up, get into this, get it out. How am I going to be better than the rest of my entire organization and prove it? By the one, number 1 in the country. Haven't even met you guys yet. Imagine when I unleash all you people on the street. So I have very limited people who are trained. We don't have a managed care reimbursement yet. We're working on it, just like you guys are. You talked about it earlier. Everybody's interested in scrambling. I want a heart failure program. I don't know where to start. So if you guys can do a little research, I do too. How do we help them start a heart failure program? Let's meet a nurse practitioner. Let's talk to them. Take them out to lunch. Hey, how did you get started? Then a couple key words. Boom, I'm an expert. You don't know anything yesterday, but today I know. So, pockets of lack of remote monitoring. We're big into remote monitoring. So everything is going telemedicine through the internet. Prevention, proactive instead of reactive. How am I in time? I promised you 30. Big Zeus will cut me off. So I have pockets that are missing. I have lack of product awareness at the physician level. I have lack of product awareness at the patient level. So I think you guys can certainly play in that field. Because I know a bunch of you in this room, if you gave that box out, I know that in 6 months, the owner of that box will be back in the hospital. Half of them. For every 2 boxes, 1 guy's in the hospital. I want them. I can fix them. and I can get them back to you. I'll be your patient for life. Not one admission, forever. You tag that patient, Total Home Health, St. Jude, they should know. Here, make it easy for your doc. Doc, make it easy. Just do this, doc. And you do that. Those are the only two initials that he needs to know. When he says that, you're all over. You get one call, one point of contact, you follow that patient all the way through. I do it. When he says this, I have guns blazing. My guy, he doesn't have to do another thing. Set it and forget it. You do that. You play here. You can't be stopped. Nobody will touch you. So how am I going to do market development? I'm going to initiate a pilot program with a home health care agency who focuses on reduction of heart failure readmissions, have them trained, make sure they know CardioMEMS, and they're dedicated to assist and increase compliance. If I could give you, I estimate myself in this particular area, 12 accounts doing a minimum of 25 procedures per year, all 100% Medicare. That's your flow. That's your patient population that's coming your way. And all you gotta do is have them press a button. Connect your primary care guys to my cardiologist so he can better serve your patient, improve their quality of life, and keep them out of the hospital. Any questions so far?
Jamie, are you going into the OR with them and directing them, or are you reps doing it at this point?
Me? Yeah. Me personally? No, I don't do any of that. I have heart failure specialists. I have 47 people on the team. I have a whole squad of people doing that. I'm out here creating the awareness at this point. I gave up the OR. I forgot how to wash my hands.
Do you have a competitor, someone else in the
With this? Nobody. This is the only FDA-approved product proven to reduce heart failure readmissions. Nobody can tell you that. As much as we love height and weight, it's too late. Statistically, in all the data, it's not that strong. And you guys are doing an amazing job with the tools that you have. We just catapult and leapfrog. This is a game changer technology. Expected $2 billion industry right here that started here a month ago.
So Medicare didn't cover this until a month ago? Or is it something Medicare...
This was FDA approved like 6 months ago, CMS, Medicare approved and reimbursed a while back, but by the time you get them in contracts, I mean, it takes a while. To get into the hospital, it's a very tedious process because you got to go through contracting and the whole 9 yards. It's an inpatient procedure or an outpatient procedure. Average length of time, 25 minutes skin to skin, a right heart cath. So the synergy here, Total Home Health is a leader in CHF awareness, reducing hospitalizations, 14.8% lower. I got this from than the national average. That's important to me. Openness, small enough that I can contain, I can educate. You guys track your admissions and readmissions. You have a very progressive hospitalization prevention program. And you have sales and patient advocates across Florida and Texas interacting with PCPs. So I sent this up to the VP of my company, by the way. I even put your name on there.
Thank you.
So what's the win-win, a symbiotic relationship? We work with Total Home Health to assist in awareness. Total Home Health gains competitive, not competitive, but competitive edge among their peers. You remain a leader in reducing heart failure awareness. You improve their CHF, you improve your CHF statistics against your peers. We increase the number of implants and we both grow as an organization, not being transactional people, but consultant and talking about disease state management and putting the pieces together. This is a video of the actual procedure. Any questions so far? No? We're already in Texas. We're everywhere. We're everywhere, yeah.
Every market we're in.
So, yeah. So this is a national. My little thing, what I'm doing here, this is to even get a phone call back from the regional director in Texas. I'll do what I can to help you, but and putting it together for the Texas people because I'm committed to you guys. But outside of Texas and Florida, I don't know any other organization or whatever. So what I want to do is prove, even in a quick 90-day strike, what we can do together. Let's show 90 days commitment of focus. Let's do this. Let's educate. Let's get it fast so that I can show the trends and I can attribute moving the needle at a home health care. And then you guys are going to have to triple your head count. I'm sure you'll be glad to.
All right, I'll say this.
Yours too. Last readings.
Julian, we don't have volume.
It's coming. I think he's doing the... Do you have it on mute? Any questions so far? So we're hiring, we just brought on board a therapy awareness specialist. We have two of them, one in the north, one in the south, that I can give you the contact information. And then for the reps from Vero Beach South, please, actually everybody, if I had a list of where you are geographically and your name and contact number, what I'm going to do is connect the dots for you. If you go approach my guys, they get approached all the time. Let me do it from my end the other way. But
What is MEMS?
micro electrical mechanical systems, MEMS technology.
So you want us in our areas to schedule, say, primary care doctors, cardiologists, hospital administrators to meet with you?
When the timing is right and the coordinated effort. So in some areas, that's what I'll need. In others, I won't.
How about
So-
Highlands County?
I don't know where it's
You don't know how to tap in.
at. I'm sorry.
It's tiny.
No, but in Sebring? No, absolutely. Sebring's good because we can funnel those patients to one of our sites. That'll be huge. Absolutely. And so what we ask is certain qualifying questions. We ask how many current class 3 heart failure patients are they managing? But you guys know this because I know if you're this far ahead of the game, I bet if you look into your portfolio, you have a bunch of names right now. Doc, this guy was in there again. Hey, have you ever looked at this? I just was at a meeting. This may be okay for your patients. You want me to get you in contact with the local hospital or the cardiologist? Who do you send to? Or you say, who do you send your patients to cardiology-wise? And then you connect that cardiology to that. And then you say, hey, Mr. Cardiology, I'm bringing you a referral because this primary has a problem. You're the cardiologist. You're building that bridge. Then he'll send it to me.
And this will be really important when your primary care and your cardiologist get reduction in pay for patients as well as the hospital.
Absolutely. This is a win for everyone. That's what I'm saying.
What's the Medicare reimbursement for surgery?
Medicare reimbursement, DRG 264, is variable for the state of Florida. It depends on the pockets and zip codes, about $16,850. CMS approved a new technology add-on pass-through payment of an additional $8,800 because they believe in the technology so much that there's